Okay, good afternoon. My name is Brian Wilson. I'm the General Manager with Commonwealth Home Health Care. I'm a respiratory therapist as well. This is Tennille McDowell. Tennille's a respiratory therapist with Commonwealth, and Erica Thompson, who's the Operations Manager with Commonwealth. We'd like to, this afternoon, talk a little bit about a CPAP device. CPAP is in continual positive airway pressure. A lot of times our customers and our patients have some difficulty at home or in the field when they're using this device. So we want to just go through and talk a little bit about how a CPAP machine works, how things connect and plug in, some troubleshooting ideas that maybe you might want to try before you had to call someone for service. And we'll just have a general discussion about CPAP. Very informal. The idea is maybe to educate you on something new that every time we fool with it, I learn something else. So this is a good way to do it. This particular device we're using today is a ResMed S9 CPAP machine with humidifier. Sometimes our clients in the long-term care side, they'll use the CPAP machines, but they won't use the humidifier side to a CPAP machine. And some patients, myself being a CPAP user, I use my CPAP machine most of the time without a humidifier. I must admit, the reason I don't use it is I'm lazy. I don't want to have to wash and clean my humidifier, and that's a key factor in using a CPAP with a humidifier. Its water is inside it. If you let the water sit, it gets dirty, and then you're going to breathe that in. And no matter what anybody tells you, that can't be a good thing. It's like having a glass of water on the countertop. You fill it up, and every day you take one little sip from it. Nobody I know would do that. So it has to be cleaned on a regular basis. But we'll talk more about that in a minute. This device comes in two pieces then. So this would be the CPAP side, and this side is what you would see all the time when a patient uses it. They have to have this side. On the back of this device, there's a plug-in. This is where the power plugs to the back of the machine. Sometimes that can come loose, not fall out, but be loose. And you would think, well, my machine's not working, I don't understand, and it's because it's not getting the power. Remember, with a CPAP machine, when this is plugged in and it's plugged into a wall, you're going to have a screen that lights up. And if that screen is not lit up, we have a power problem. Automatically, we know something's not plugged in right, or for some reason we're not getting power. The other thing on the back of the machine is a filter. You've got a filter here that comes apart that basically is thrown away, and we put a new filter into the device. You can tell by discoloration when it changes color, and you can actually see the dirt. And when you open it and look at it, typically just once a month, I guess, would be the most frequent, but some people are funny too. They'll open it up, look and see the dirt and want to put a new filter in. But your insurance company typically, from a reimbursement perspective, once a month, they'll let you get a new filter for your device. And it just plugs right there on the back. It's very simple to get to. The other thing on the back of the machine that sometime you may have to deal with is your card. And it's just like a computer SD card. It just pops out here in the back. You just give it a little push and the card comes out. You would take this to your provider and they would download the compliance on your machine. And it shows your physician how frequently you're using the machine and if you're having problems while you're sleeping at night. This card is going to record that. And so we can help you overcome those problems. It just slides in, a little push, it locks into place. Very, very simple. So that's the CPAP machine in itself. On the top of the CPAP machine, you've got an on-off button on one side, and then what I like to call a control knob on the other that will allow you to look at different things on the machine, and I'll let Tennille talk about those more specifically in just a second. If you happen to use a humidifier, the S9 is very nice. Comes in two pieces, and it's simply the two machines just push together and lock into place. And now my humidifier is attached to my CPAP machine. And if I can do that from the back side, and you can see here's the humidifier itself. and water goes into the top of the humidifier. It has a fill line inside that distilled water again or sterile water. Don't recommend using tap water. There are a lot of different things out there now that say, well, maybe you can. The recommendation, I just look at it from best practice standpoint, is to use distilled water or sterile water. When you put that into the humidifier, fill it to the fill line, and the fill line, it may be hard to see on camera, but it's real easy when you look. It has a max and a minimum, a little yellow tab inside, tells you where to put the water level to. Once you do that, this sets down in the machine. It's not very sophisticated, really can't do it wrong. Once it sits down in the machine, you close the top, you're ready to go. Now, a couple of things on the humidifier. I told you earlier about cleaning a humidifier. They have changed these now. So they have little tabs that pull down on each side, all the way around, all four sides, and it comes apart. So it makes it a little bit easier to get to the device to see what you can rinse and clean and wash out and add water to it. On the humidifier itself, comes apart. When you go to put it back together, remember, you see, if you look at it, there's an angle to this one corner here, and there's an angle here. So if you're confused, sometimes it's very easy to be confused putting it back together. As I have demonstrated on occasion, line up those angles, then snap your tabs so they all fit back into place. With the humidifier again, you drop your humidifier down into the CPAP machine so that it is ready. Close your top and it's ready to administer humidification to the patient. Okay, now let's talk a little bit about the knob here on the front of the machine and the screen. Tennille, why don't you tell us a little bit about what that knob's for, what different features the screen have for the patient?
Okay, the patient controls can be changed with this knob here being the humidity level that the patient gets and the ramp, which we'll explain the ramp in just a second. There will be a little water drop on the front of the machine that stands for the humidity. The higher the number, the more heat you get, the warmer the air. The lower the number, the cooler the air, the less humidity. To increase this, you can turn your machine on with the start-stop button. This square will be yellow. At that time, changes can be made. You would turn this dial clockwise to increase the temperature. It'll increase in half increments and will go all the way up to 6. We recommend starting off around 3. So when you make the change, you see the desired temperature here, you would just press that button down to lock it into place.
So I set my number, whatever it may be, then I go back and push the knob, and that sets that number permanently until I want to change it again.
Yes.
And if I wanted to change it again, what would I do?
Press the dial down again.
Okay.
Make your change.
And then
press it down again. And you'll notice that the screen will turn blue. You're locked in, ready to go. You can turn it off if you like. When you press this, turn it down to off, lock it in. There's a light on this side. When the heater is not used, this light's going to be blue. When the heat is used, the light will be orange. That doesn't mean anything wrong. It just means that this is heating.
Yeah, I think that's a really important feature. A lot of times we're used to red lights or orange lights meaning a problem. In this case, it's a good thing. It's saying that your heat is on, just reminding you that you're using the heated humidifier when you use it. Because not all patients will use heat. They will just use the humidity in itself. And remember the point Tennille stressed, low number is cooler, a higher number, it goes from 1 all the way to 6. At 6, it's warmer. So one of the things I know, Tennille, sometimes when I use a heated humidifier, I'll wake up in the morning and I see a lot of water in my line, or I'll actually have water sometimes on my face. It feels like it's wet. So what am I doing wrong? In
that case, we want to decrease the humidity level. So you would just go back to your machine and decrease the temperature and set it. There's no right or wrong when it comes to this setting. It's just whatever is comfortable to you.
Okay. So what do you mean by ramp?
Okay. What the ramp does is allows us to start the machine off at a lower pressure and gradually increase it to the desired pressure set by the doctor.
And I think as a CPAP user, again, I told you I use a CPAP machine, so sometimes I relate really well with patients when they have problems. And I know when I first started using CPAP, my doctor, remember a CPAP pressure order could be as low as 4 centimeters of pressure. Sometimes they can be as high as 20. We've seen them that high. And if you were using especially 14 and above in pressure, it's a lot of pressure. When you put that mask on your face at night and you hit that on button, boom, it's explosive to the patient sometimes, and it's very uncomfortable. And so we're trying to go to sleep with that pressure blowing in our nose, and that can be difficult to say the least. So the idea of the ramp, if I understand you right, Tennille, is when I put that mask on and I turn my machine on, it's going to give me a full pressure for just a second to make sure my mask is seated right, and then it's going to drop so that I can be more comfortable and breathe easier. Okay. How long does it take it to get to my pressure?
That's something that the patient can decide on their own. No, typically we ask them how long it takes for them to fall asleep, and we set it accordingly. It just really depends. If it's a lower pressure, I'm going to put it on a lower number, 5 minutes, 10 minutes. If they're a higher pressure, I give them a little bit longer to try to get used to it. It'll go up to 45 minutes and the least being 5 minutes.
So it kind of gives you a chance to fall asleep, and then it goes to high pressure so you sleep comfortably, hopefully, and not realize it. Okay, Tennille, let's say I can't go to sleep. I'm having a hard time going to sleep, so I need to reset my ramp. Are there things I can do to say, I know I just don't feel like I'm going to be able to go to sleep in 10 minutes, or I put my mask on, I'm laying there, 10 minutes later my machine's now at full pressure and I'm not asleep, so it's uncomfortable. Can I go in and make some changes to my ramp? Is that pretty simple to do?
Yes, you would just take the dial, scroll down until the ramp is highlighted, looks like a little triangle. Right now it's set at 10 minutes. We would press the button down, the screen lights up yellow, we know we're able to make our change, turn the knob, and it goes up by 5-minute increments.
Okay.
You can go up to 45 minutes or as low as 5.
So
you just press it.
There you go, and it's locked in.
And that locks it in.
And so it'll start at the lowest pressure, and over a period of 40 minutes, it takes me up to my prescribed pressure.
Yes.
Okay, great. That's pretty simple. How about the tubing? How does that work?
Okay. With this tubing, we call this one the climate line. You'll notice that one end of the tubing is different from the other. This end would attach to the machine. It's got an electrode in here that locks into place, and this is a heated wire that runs through the tubing here to keep it at a constant pressure. This can reduce the chances of you having that humidification in your tubing and on your face. Some of the tubing that doesn't have that, the chances are greater of you getting that humidification and the moisture in the line. This just slides on and twists and locks into place.
That's easy enough. See, it was pretty, so you can actually tell when it's hooked up good because it really snaps in there.
Mm-hmm.
So you know, so I'm assuming one problem a patient sometimes might have is they think
it's on there and it's not.
And it's not. So, because it's plugged in the back of the machine right now, but it's not twisted and locked into place. So that would be one thing you might want to check. Okay. How about the other end?
This end is standard. It will fit all masks. There's nothing special to it. It's just kind of rubbery, flimsy, and it's going to fit on the end of the mask. Like this. Now, all the masks are going to have some type of adapter to it to where this is going to twist, and the mask you can move freely. You don't have to feel like you're confined. You have to lay in one spot. You can move freely and sleep. Now, all masks are going to have some sort of exhalation valve on them, so you will feel air blowing out of the mask at some part of the front of the mask. Sometimes it's here in the elbow. Sometimes it may be up in some fine holes that you'll see on the mask. But all masks will have some sort of exhalation valve.
And I think it's important to really stress when we talk about the mask side. There are a lot of different masks out there, a lot of different sizes, shapes, and colors. So that's a good explanation. Some have exhalation ports in different places, but all of them are going to have that. And sometimes, again, as a CPAP user, I know when I first started, I thought I had a leak. I thought my mask wasn't fitting well. And then I realized it was allowing me to breathe. It was a good exhalation port to get that exhaled air away from my body back out into the atmosphere. One question about the hose. I know this is one particular type, but there are other types of hose as well, right?
Yes. There's a standard one that does not lock into place. It doesn't have the heated wire. It just slides straight on and would slide straight on here.
And this piece, I notice my hose at home, I use one that's not like this. It doesn't have the cable there, but it's bigger as well. It's a little bit wider, so easy to tell the difference. Plus it doesn't have a connector on the back, but it's also a little bit bigger in diameter.
And even though the diameter of the tubing is larger, the end is still the same and will attach to this machine or any mask.
Okay, cool. When we talk about CPAP mask, I know that's a big end. That's a hard topic for us to really get into in this segment, simply because there's so many masks out there. But remember, your doctor is going to prescribe for you the mask of choice. Typically that would be from a sleep study where you've been monitored while you sleep at night by a sleep physician, and they determine what mask best benefits you. The biggest difference, I guess, in mask would be a nasal mask, one that just fits on the nose, or a full face mask that covers the mouth and nose. And then, of course, we have masks that have the nasal pillows that fit inside the septum itself, just inside the septum. So you don't have a lot of mask. It's actually just a little piece here. So I would say those are probably the three different styles of mask that you would deal with. I know that with the CPAP mask, most of them have safety features to be able to get the mask off quickly.
Yes.
That's pretty standard. I know on this one it's just a little quick connect there, okay, that pops off. Remember, with the mask, problems that we see with a machine, and an S9 is one of these machines, that if you have a big leak, if you have your mask on and your mask is leaking a whole lot of air, you correct me if I'm wrong, but this machine will actually turn off.
Right.
And we would be able to tell that by going back and looking at the card. I know I've had some patients call and they'll say they woke up in the middle of the night and their machine had turned off. And a lot of times it can turn off because of a big leak. You rolled over. I know when I wear my CPAP mask, I do not lay still.
Right.
I move a lot. Even though I'm wearing CPAP, I'm just that kind of person, I guess. And when I turn my head, sometimes my mask can get a pretty big leak.
Right. Rather
than just blow air, the machine itself will cut off. Now, is that a setting on the machine, or does it automatically do that?
We can change it to where it won't.
It'll actually stay on no matter what.
Right.
Okay. And I know this machine also has a real nice feature, right? When you put your mask on, you don't have to lean over and hit a button. You can just lay back, get comfortable, and start breathing, and it'll cut on.
Yes.
Which is really nice. So, Erica, can you think of anything that people have problem-wise with CPAPs that maybe we haven't talked about?
No, you covered the tubing. That's one of a big complaint that we get, the different size tubing, just the question of if they're universal.
You know, I think from a therapist perspective, and I'm trying to think from a patient perspective. When I wear my mask, problems that I encounter as a patient, and most of the time, issues with CPAP are not here, they're here. They're at the patient's face. Obviously, learning to sleep with a mask on your face is a challenge. It is typically, I was a very unusual breed. I put my mask on, I went to sleep. I mean, it didn't take me a lot of struggling with masks, but I also know, and you all know, I'm finicky about my masks too. There are only certain types of masks that I'll wear. So what patients need to understand is there are a lot of different masks out there, and you've got to be able to work with your provider. And if it doesn't work, you're not comfortable, don't simply quit on the therapy. I can't stress how many studies in the last couple of years that have come out, and they talk about how critical it is to treat sleep apnea by using a CPAP machine. When you let it go and you have episodes of apnea, remembering your heart is not resting, your major organs are not resting. If I went out for a walk and decided never to stop and rest, at some point my legs are going to quit. I'm going to run out. And our heart, our major organs, the whole idea of going to bed and resting at night is to allow them to do just that. Slow down, rest, rebuild, be ready for another day. And when we suffer from sleep apnea, we don't get that opportunity. Your heart pounds all night long. Your oxygen levels sometimes will drop when you're not breathing, obviously, and you're going to wake up in the morning and you're going to feel like you ran a marathon and that you didn't sleep. It's critical that we fix that. And CPAP is one way. And I've had many patients, and they'll come in and say, I tried this last night, I can't sleep with this on, and they're ready to quit. Very few patients will ever put that on in one night and be accustomed to it. I would say typically a month to 2 months sometimes of trying different masks. And you'll be surprised. One mask is terrible, and you'll put on one time, you'll find that right mask, and it's like, oh, it's a miracle. And you're going to stick with that and use your CPAP. So your provider should be very willing to work with you and try different masks and talk you through problems with the machine. If your provider won't do that, then you probably need to pick another provider because it is a difficult process, but one that your provider's got to be willing to walk with you through to teach you how to use this equipment. I think that's pretty much all we can talk about just in this short fashion, but hopefully this was helpful talking about a CPAP machine and how patients benefit from it. And remembering, as with any medical device, first of all, we always treat the patient, never treat the machine. Always pay attention to how the patient's doing, then work back to the piece of equipment. And remember, check the basic things when we have problems with equipment. Plugs in the wall, are they plugged in? It would amaze you how many times we travel to someone's house or to a nursing home where they have a problem and we plug it in the wall or plug the power cord in the back of the machine and the problem's fixed. Sometimes that happens. That's okay. We just remind you, check the simple things first. Always check the patient first, though. Always start with the patient and work your way back. Is there a leak in the mask? Is the hose connected right? Is my humidifier connected right? Is the machine indeed turned on? Do I have power coming to the machine? Is the power cord plugged in? Always work your way all the way back and check every little bitty thing. Typically, CPAP machines don't fail. They're very high quality, good pieces of equipment from all the manufacturers that make them. So most of the time when we have a problem, it's a people problem and not a machine problem, typically. So we appreciate your time this afternoon. Hopefully this training was beneficial to you. Again, if you have questions or concerns, feel free to call 1-800-289-3898. That's Commonwealth Home Health Care. Ask for one of our therapists. We'll be glad to talk you through the problem, get things taken care of for you. Have a great day.